Good morning and welcome to the HIA-LI 29th Annual Economic Summit. You know, this is a real opportunity for us to get a pulse of what's going on in the Long Island economy and a forecast for the future. Our members are saying they are cautiously optimistic. You know, yet we still struggle. We struggle with the availability of skilled workers and our retention of young professionals on Long Island. But again, the base of today is about really looking at these leaders and hearing about their industries and their forecast for the future.
Good morning. I'm Rich Heumann. I'm the CEO and president of H2M, Architects and Engineers. Honored to be a panelist today at HIA-LI's Economic Summit. Really looking forward to it. I'm one of those optimistic CEOs. My company really thrives in the infrastructure element of the economy, so a lot of funding clearly coming down from the federal government, from New York State. Things like roads, bridges, water, wastewater, infrastructure in general. So from my perspective, I'm really looking forward to not only today, but 2023. Have a good day.
Hi, good morning. Dr. Patrick O'Shaughnessy, President and CEO of Catholic Health, and I am cautiously optimistic about the economic future of Long Island. There are certainly headwinds that we're facing in terms of, in the whole industry, labor challenges, making sure we have enough of our future healthcare heroes, but we're growing. The industry is expanding, and we are very, very well positioned to care for multiple generations of Long Islanders here at Catholic Health. So I'm very optimistic about what the future holds. New science, new technology, state-of-the-art facilities, and being able to provide care really right in your backyard, and then also digitally connect our population. So I think now more than ever, the future is very bright for healthcare on Long Island, and especially with Catholic Health.
Good morning. Kevin O'Connor, CEO of Dime Community Bank. Happy to be here. Always a great time at this conversation, this forum, where we discuss what's going on, people's perception of the economy. I run a bank. It's certainly challenging times today with where interest rates are, and we head into recession or not. It's a question, but I look forward to the discussion here today.
Welcome to the 29th Annual Economic Summit. We have some crowd here today. We have a packed jam program. We have a very distinguished and wonderful panel, which you will hear from in a little bit. So it is my honor and actually privilege to actually introduce another dignitary who's in the room, which I want him to come up and make some comments, and that would be Congressman Nick LaLota. Congressman?
Good morning, everybody. How's everybody doing? All right, good stuff. Hey, very good to be with you this morning. Thank you for what you do for our business community here on Long Island. I know government doesn't always make it easy on you folks to make your payrolls and make a buck and to ensure that you have a successful business, but I can tell you that we're here to make it work for you. I want to say thank you for your leadership in that. I'm part of a new majority in the House of Representatives, and we have three hardworking folks from Long Island, Andrew Garbarino, Anthony D'Esposito, and I, who are going to put Long Island first, going to put the party politics aside, and we're going to make sure that on our own committees and in our own conferences, we ensure that we get Long Island's business done. I'm fortunate to serve on the House Armed Services Committee, the Homeland Security Committee, and the Small Business Committee, of which I'm a chairman of one of the subcommittees there. And I think it's important that we put Long Island first as we focus on our business down in Washington. So much so, and to get rid of the party politics, I was one of a few members to cross the aisle during the last week's State of the Union to shake the president's hand and to let him know that there is a openness to our relationship. There's a partnership available because we ought to be working together for our common constituents. So my office is available to you. My office is available to you. Peter's in the room right now in the back. If you want to swap a business card with him, please feel free to do so. And especially if you have any business that you think might be before the Small Business Committee, my door is open as well. So second time in 2 months I'm able to speak in front of your group. That's pretty awesome. I hope to get invited back again. But nonetheless, God bless. Enjoy your morning. Thanks.
And now it's my pleasure to introduce our president and CEO of the HIA-LI, Terry Alisi Maselli.
Well, good morning, everybody, again, and welcome to our 29th Annual Economic Summit. Real excited, equally excited this year because we partnered with two local companies Citrin Cooperman, and thank you to Mike Sabatini. You'll hear from him in a moment. Where's John Giordano? Where'd you land, John? Raise your hand. John Giordano, Dawn Needleman, who worked very hard on this survey with Adelphi University and Marianne Highland, my old alma mater, and her crew. So they were a pleasure to work with, really, to administer and create this. So, we understand that today, probably more relevant than ever, that we take the temperature of Long Island business, right? So you've talked to us, and we've mentioned also from the HIA-LI's standpoint, 2022, for many of us, a year of rebuilding. Cautiously optimistic as I speak to many of you, yet we still struggle with the availability of skilled workers. We still struggle with the mass exodus of young professionals. Past studies have told us 67% of our young professionals on Long Island between the ages of 18 and 35 are considering leaving Long Island within the next 5 years. In 2025, 75% of the workforce will be young professionals. That math just does not add up, right? Yet, there are so many positive things happening on Long Island. So when Dr. Earl walked in, I congratulated him. Was that yesterday, Dr. Earl, that happened?
Yesterday.
They just opened a mother-baby unit in Good Samaritan, although many of us are years over that. Yes. I thank you from really the bottom of our hearts for moms who are delivering and, yeah. So for those young professionals, that life-work balance is really, really important, so thank you. I don't know Bob Coughlin. I don't know if Bob is here. Hi. Just a shout out to the work they're doing, things like Shoregate, yes, and Station Yards. I mean, they are continuing to lead in developing on Long Island. So some phenomenal things happening on Long Island, really. And I'm going to mirror what the congressman said, right? We have to get out of your way and let you do these great things. So again, today is really all about getting a pulse from this economic survey, and these leaders are really going to interpret it based on their experience and the industries they come from. Just to go back for a second to what I was saying about the mass exodus of young professionals, we have formed a workforce development task force. It will be led, or it's being led, by our very own Rich Human, who's the CEO of H2M, with the help of Ed Bonahue from Suffolk Community College. We are fortunate to have these two gentlemen really leading this because they understand the importance of, again, really helping every business on Long Island get the resource they need for the availability with these skilled workers, right? To help your businesses grow. So we will be, hopefully, doing a skills set analysis, hopefully, with our partners, our very good partners at the Suffolk IDA and the Workforce Development Institute and Suffolk County Department of Labor, to look at what does the skill set look like right now, post-COVID. Very excited to say post-COVID, by the way. And, to continue to make that connection with academia and business. So much more to come on that. We are leading the way in that area. And again, I'm going to turn it over to, so Michael Sabatini is the managing partner of the Long Island office of Citrin Cooperman. He's a brand new board member as well. We're delighted to be working with him, and he's going to be our moderator this morning. So help us welcome up Michael Sabatini.
Thank you, Terry, and good morning, everybody. Certainly a pleasure to be here to review the results of the 2023 economic survey with you. We certainly have a fantastic panel to share their insights and comments to the key findings in the survey. Okay, the big three. So inflation. Just I want to highlight a couple of things on this slide. So 55% of respondents say they've taken some action against inflation, and certainly that's a question we have pretty early on in the panel. What are those action steps? Raising prices, with increasing labor costs, looking at automation, more focus on automation. Supply chain issues, as we said, 37% think this is going to linger for another 12 to 24 months. Human resources, certainly a lot of data coming out of the survey, expecting payroll to increase, more so due to rising costs, compensation, inflation, healthcare benefits, et cetera, than necessarily because of hiring. And we want to get into a little bit on the, kind of the return to work, the, remote work, hybrid work environment. And 41% said they've, required staff to return to work some period of time, maybe not 5 days a week. 59% are offering some sort of fully hybrid or remote option. Economic outlook and government assistance. So certainly we asked our respondents what they think and that, and given that the last couple of years, 2022, 2021, there was lots of assistance, PPP loans, ERTC credits, et cetera, kind of those, we'll call them goodies that were provided to businesses to help, keep afloat, keep payroll, keep people employed, et cetera. And now, some of these may be going away or not continuing. So we asked about plans to expand business. Some, yes, on Long Island, 38%, I think. It's a little small, but I think it's 38%. Some outside Long Island, some no plans to expand. I guess the good thing is very little said they plan to decrease footprint on Long Island, so that's good. Capital improvement, certainly a big area. You could see the breakdown. Most respondents plan to do something, a lot centered around technology, no surprise, especially with the shortages of skilled workers. Performance expectations of the government, which will be certainly part of what we're going to discuss and where kind of business owners and our respondents feel that government has performed, and as we see, some favorable, some fair, of course a fair amount poor, particularly on the federal government side, and we'll get into that with our panel. Okay, so that's a brief results of the survey, but really we want to hear from the panel and what they think and what they've seen in their businesses, what they've seen in the local economy, their interactions with government. So let me introduce our panel members. So immediately here to my left, we have Renee Danielle Flagler, Executive Director, Girls Inc. of Long Island. We have Rich Heumann. Rich Heumann, President and CEO, H2M Architects Engineers, HIA-LI board member and past board chair. Dean Mary Ann Highland of the Robert B. Willemstad School of Business at Adelphi University. Kevin O'Connor, CEO, Dime Community Bank, HIA-LI board member. And Dr. Patrick M. O'Shaughnessy, otherwise known as Dr. O, President and CEO of Catholic Health. All right, so let's get started here. So let's start with one of the big three, inflation. So we'll start with you, Kevin, since, good place to start here. What are you seeing as it relates to inflation? How long do you think it'll continue? And what are some of the actions that you think can be taken to mitigate its effects?
Well, I guess I was going to give you my thoughts, but I had the opportunity yesterday to actually, John Williams, the chairman of the New York Fed, spoke to a group of bankers, and we actually had some people, Lorraine Gregory were there yesterday. So he has been one of the more hawkish governors on inflation, and if you look at what he said and take that in context, there's a real push-pull between the market thinking that the Fed will be done relatively quickly, even people predicting rates being dropped in the second half of this year. I don't know anybody that could have left that room thinking that that's what's going to happen. Inflation being as a concern to every business as it is a big concern to the Fed. We've had 40 years of benign inflation and how we've been able to weather some pretty big economic upheavals with knowing that as a backdrop, not something to worry about. The Fed recognizes that this is their primary job. He basically telegraphed that he wants to get inflation back to 2%, and they will do whatever they need to do with rates. So we've had unprecedented rate increases. I think when I spoke last time, I think I talked about potentially up 400 basis points, and we've been there. It's probably going to go up 500 basis points. I look at the bankers in the room, it's a scary time. But the thought is that we do need to get this back under control. We've probably gotten all the good news on inflation from the improvements in supply chain, the drop in fuel prices, all of that. The part of inflation that can become sort of permanent is when it starts to filter into what we do and it comes into wages and salaries and it fits into the human resource issues we're talking about. So, it's here for a bit of time. The Fed will do everything it can
I anticipate rates going up above 5% on the Fed funds rate, which means prime rates will go up, and we can talk how it affects our customers. But they will continue to fight this and keep it high for long because they think that is really the key to what's created this economic growth that we've had in the last 40 years. So it's a bit scary from that standpoint. Again, I'm a banker. I'm usually the optimistic one up here, so a little depressing. But I think that, they're out there. They understand what they need to do. They think that is the key part. There are obviously, I think it's economics 101. It's basically supplies exceeding, the demand is exceeding supply, and we need to get that back under control. So for everyone that runs a business here, you've attempted to pass along your costs. In some cases, it's probably been met. You've been able to do that. You've been able to increase your revenue and things like that. But we're all going to have to sort of deal with higher interest rates for a longer bit of time and what that translates into through all of our businesses.
Thank you, Kevin. Renee, I want to turn to you. Certainly not-for-profits rely on fundraising as one of their key sources of income. So how has the rise in inflation and some of these economic factors impacted your fundraising efforts?
So for the nonprofit community, it has impacted us in several ways and from both sides. So from the business sides, unfortunately, we are seeing less discretionary income or less income coming from nonprofits, coming from the business community, which is our biggest supporter, into the nonprofit world. They're more cautious about giving. Some of them have less to give because of profits or simply because of the fear of the unknown. We're not sure what's going to happen. So we went from having a very robust funding, season, and having a very, how do I put this, just generous season, like knowing that nonprofits went through a difficult time during the pandemic, and we saw a number of our funders give extra, right, to say, we want to help support our community. But what we also saw were, when it comes to certain sponsorships, we saw the lowest amount of giving in the past, I would say, 2 years or so, where when we even go for grant funding, the pool is a little smaller for the nonprofits they're able to provide to. And then, of course, on the flip side of that, we're serving vulnerable communities who have less and less. They're more squeezed. The funding that the money that they do have is really going towards those things that are really essential in life. So anywhere where they would have been providing more discretionary income, we've seen a little bit of the individual giving go down. So we're kind of getting hit a little bit from both sides.
Thank you, Renee. All right, I want to shift gears a little bit. So talking about young professionals on Long Island, and certainly something that was raised in the survey as a major concern and something that we've talked about in past meetings, et cetera. So Rich, I want to turn to you. So based upon our survey, 38% of our respondents expect to expand business on Long Island. 18% outside and 44% have no plans for expansion. So, but we're also facing this young professionals and families leaving Long Island. What do you see, or what are you seeing as a potential solution, and how do we address this disconnect?
Yeah, so I appreciate the question. I think for us, we've been a growing organization for really the last decade, and about 70% of the cost for us to do business is in our people and our payroll. So we're upwards about 500 employees right now and 350 or so on Long Island. And we are looking to grow in 2023. And it's been by far our most significant challenge has been how do we attract and retain our young professionals. So, things that we have done over the last couple of years and then really, utilize the positive consequences of the pandemic to our advantage as best we can, where instituting really strong flexibility programs internally and trying to be in the best position to accommodate the needs of our staff and understand what motivates them, what they're looking for in their career, investing in developing them, looking to send a message where if we can invest in them and create value in them, in turn that'll create value for our company. We've embraced a hybrid work environment where we have some staff, if they want to work from home, full time, they can. We encourage them to be in the office as much as possible because we believe that the benefit to them and their own professional development is going to be enhanced when they are working as part of a team and working with their managers directly. We also are frankly trying to leverage remote work in a way to broaden the net to recruit. So we will hire people in other states. So technically they could be working with our team on Long Island, but they could be living in Ohio or South Carolina or Georgia. So really, and at a time where I know all of our industries are really fighting the tight talent pool. The AE industry is just as tight as any other industry. So it's been a war for the last 3 years, and I see it continuing. So to all of us who are running our businesses, I think making sure that you're not looking at business as usual, and this is how we've always done it, therefore this is how we're always going to do it. We need to be the ones to adapt, because if we don't adapt, our people are going to take opportunities with other companies, and that's something that is really top of mind for us.
Thank you, Rich. So I'm going to turn to you, Dean Highland, and just certainly, from the higher education perspective, what are our Long Island higher education institutions doing to attract, retain students, retain competitive, and feed that Long Island workforce that we are starving for, more workers?
Sure, thanks. So students need to be able to develop the skills that they need for today's jobs and tomorrow's jobs, and the jobs that are here on Long Island. Many of our students want to stay on Long Island. We attract students from outside of the Long Island region, but also a lot of local students who are from Long Island and they want to remain here. So we have to look at the industries that are growing, such as healthcare, developing degrees and programs that are in the clinical space, but also in the non-clinical space when it comes to these growing industries like healthcare. Also, fields that are in demand, analytics, supply chain management, more and more related to technology. So we keep that in mind when we're developing programs to attract students so that they can build their skills, but then also build their careers here on Long Island.
Dr. O'Shaughnessy, I'm going to turn to you because obviously there's always concern about having enough healthcare workers out there to certainly serve the demand of an aging population. So your thoughts?
Yeah, sure. Thanks for the question. So, we talk a lot about long COVID from a physical sense, right? But COVID also gave us some lingering effects on our economy, as we've learned, and also looking at employee burnout. And I think for all of us in business, we've seen this. So many of the workforce decided after coming out of COVID that they were going to change their life and do some different things. And the period has been termed the Great Resignation period, right? So we've put a variety of tactics in place to really advance recruitment and retention. We are healthcare on Long Island. We live here. We've had our babies here. We care for our seniors here. And so we're very much focused on connecting in with members of the community and attracting them into the healthcare space. So what have we done? Well, financially, in the last 2 years, we put over $30 million into market rate adjustments, making sure that we're paying our staff at fair and appropriate wages and being competitive in the market. But we're also building bridges, right? Because number one, what people want is they want to know they have a career, not just a job. So we're providing careers for our employees. And we're connecting in with the higher educational organizations. We have programs with Dean Highland. We have programs, Ed, with you to build that connective tissue to our young workforce. How are we going to care for ourselves if by the year 2030, we are short 1 million nurses in this country and perhaps over 300,000 primary care providers? So we have to build that bench. So it goes beyond wages. It goes to really making sure we can offer folks not just a job, but a career. And that career ladder growth and the programs that we've put in place at Catholic Health is why we're seeing, I think, enhanced retention. And people stay with us, Mike, for not 5 years. They stay with us sometimes for a career, 30 years or plus.
Great. Thank you. Okay, so let's shift gears a little bit, and we transition more and more the way things were back pre-COVID. This room's a great example of everybody here. So question that came up in the survey, and we talked about it a little bit about, hybrid work, remote workforces, what are companies doing? And we know this is always it's a bit of a touchy subject. How forceful do you require people to come back to the office? Obviously, there's benefits of being back, as we all know, and we'll talk about in the panel, versus maybe young people and young professionals thinking a little differently through COVID. So I want to address really with a few of the panelists here, in terms of what are we seeing in your field? And I know, Rich, you talked about it a little bit, and so I will probably start with you again. What are you seeing in your field, investments in technologies you've made, to accommodate sort of this hybrid workforce?
So we were, I think, an early returner to the office in June of 2020. We started to get our employees back in. And essentially our philosophy was, we're more successful as a team, and we believe our employees needed to hear that message over and over and over again. If they got too accustomed to working from home, it would be much more difficult to get them to come back into the office. And that was challenging for sure. So we needed to be able to not only provide the flexibility to them, but provide the technology to them to allow them to try to do their job as well, whether they're working remotely or in the office. So we invested significantly in our IT infrastructure like we had never before in order to provide those kind of opportunities, adopted numbers of different apps, developed some of our own apps where some of our offices that are hybrid, we have online reservation systems, so people, if they know they're going to be out of the office a couple of days next week, but they want to work in a certain spot, they'll reserve things on their app, and everybody will know who's going to be in the office on a given day. And that's really helpful because people that know that they need to work with their peers and their coworkers in order to get their work done, they know who's going to be available. We've adopted some virtual reality technology in our office to help people work as part of a team. So even if they're not with each other physically, they can figure out ways to be working with each other remotely, which is cool, and it's emerging. I wouldn't say it's nailed down yet, but it's something that we are looking at as making sure that in our industry we could leverage technology in the best way we can, not only for our employees, but also for our clients.
Rich, do you see this pendulum swinging back towards the employers a bit?
I do, which is a good thing. We were really forced, in my mind, to be as accommodating as possible because it was so easy for people to make their own decisions to leave your company. And that was hard. And when it was so easy for people to leave, you think twice about what you're doing with your own organization. Is my company strong enough? Does it make enough connections with our people to keep them here if it's so easy for them to leave? So there's no doubt in my mind that it is swinging back, I'll say more to a neutral setting where the offerings of the company and what's motivating employees is kind of getting back in equilibrium where it hasn't been over the last couple of years. I think that's a good sign for the business.
Good. Dean Hyland, I'm going to turn to you. What are students saying? What are students looking for? What are they thinking about as they're going through? And how are higher education universities kind of coaching these students through a career center setting as to what to expect?
Thank you. This is a topic that I could talk about for a long time. It's just something that's so important to the workforce of the future. Flexibility is the word. And that doesn't mean fully remote. That doesn't even necessarily mean a formal hybrid schedule. But they are looking for flexibility. And they recognize that it's not available for all jobs and in all industries. But when it is possible, it's certainly on their minds. Students are prepared to work remotely. They've been, recent graduates at least, have been exposed to all of these online learning platforms. They've done online collaboration, used productivity tools for online collaboration. They've worked in remote teams, many of them. Some of them have even worked in globally distributed remote teams through partnerships with universities abroad. So they really are prepared to have this flexibility to work remotely at least part of the time. Most are not looking for full-time remote. Interestingly, some of the job opportunities that are available are fully remote, and that's not what the students are looking for, but we see that as well. We do find that some things work better face-to-face, and students lack some of those skills because they just haven't had the opportunities. So for example, networking. I think everyone in this room knows the importance of networking. And yet our students who haven't had any networking experience have had to engage in online networking, and it's just not the same, but it's back. And so I think this room is a testament to that. So students have opportunities to engage in live networking now. We encourage that. We coach them towards that. Career fairs, campus career fairs are back. So if you're looking to hire, encourage you to get out to campuses and visit these career fairs and meet these students face to face. They're craving that interaction as well. So even though they're looking for flexibility, they do want to have some face-to-face interaction when it comes to work. As far as coaching, I guess the last thing I would say, just like we tell students, you don't ask about vacation on a first interview or compensation on a first interview, we now tell them you shouldn't be asking about hybrid work or remote work on a first interview. But they're thinking it. They are definitely thinking about it. So if you are able to offer some flexibility, as you said earlier, Rich, it really can be a tool to attract new talent and the workforce of the future. So.
That's great. Renee, I know from your employees' perspective, you feel they have a different view of what their career looks like. Do you want to talk about that a little bit?
Sure. In a lot of the nonprofit industry, it's very much hands-on. So we can't always afford to do, while we have flexibility, we can't always necessarily afford to do everything from home. So we are kind of a hybrid model as well. We still haven't gone back to the office every single day, but we're there most of the day. But when it comes to our outreach team, our direct service team, they're in the field all the time. They're out going into the schools and we're meeting with people. We do find that it does, there's nothing that can replace. The flexibility is great, and today's workforce requires that, right? So there is, to an extent, you have to have some level of flexibility, but there is nothing like being in person, having in-person meetings, bringing the team together. The coaching makes a difference, and so we've had to navigate both sides. The coaching is really necessary these days, more so than anything else. It requires a different type of management and leadership when it comes to bringing the coaches together. And then it also, if we go back to inflation, it affects and impacts, your nucleus of your economy. So, we have to be a little more fiscally responsible and astute as well as conservative, but you have to manage the fact that you have to bring people in, they have to go out, and all kinds of things. So it has allowed us or caused us to just be a lot more keen as to how we're hiring, who we're looking for, how we're managing the team costs, the level of flexibility that we have to make sure that we have available to people, and trying to get the right people in there to get the job done.
Great. Thank you. Thanks for all your perspectives on that. Doctor, I'm going to turn to you. Something I know that's been talked about, and we know during COVID there was kind of a people not going in for necessarily routine preventative medicine, regular checkups, et cetera. What have we seen now post-pandemic? Are people back in terms of going for these regular checkup screenings, tests, or is there a lag? And how is that impacting the workforce on Long Island?
Yeah, no, Mike, great question. And fortunately, we're seeing more people come back for preventive screening testing, which is really, really important. I always say if you want to bend the cost curve of healthcare, you need to bend the disease curve. And so while 80% of our business likely will always be in managing sick care with our amazing 16,000 healthcare heroes, we're really working hard to bend that disease curve and get upstream and keep people healthy and keep you out of the hospital. And I think that's where the greatest opportunity is. And the way that healthcare is changing and advancing today in terms of technology, tests, precision medicine, genomics, there is so much available to all of you and all of your employees where we can help work with you to keep you healthier, to keep your employees healthier, to reduce your overall expense burden, and overall, to increase longevity. That's one of the big areas that we're working on. So yes, to answer your question, people are back doing most of the preventive screenings, whether it be mammographies, colonoscopies. But I invite you all, please, spend time with your primary care provider. There are so many new tests out, blood tests and things that we could offer you to actually pick up things far earlier and prevent disease, and that's vitally important. The downside to what happened during COVID, when elective screenings were closed, and I was very vocal against that, not for the economic issues relating to that, but really for the fact that I knew it was going to happen from a public health perspective. And what did we see? Rates of cancer going up, later stage disease now being found. Okay, cardiovascular disease accelerating, and probably one of the biggest tsunamis we're facing now is behavioral health. And we have, again, climbing issues with addiction and substance abuse on Long Island. So these preventive interactions are so important. I'm glad to see that they're back.
Great. All right, so let's shift around to what government can do and what government can do to help. So I'm going to start with really focused on federal governments. And so we know that 2023, and we said this earlier, will be unique in that it will be kind of the first year since COVID. We're not going to have major forms or expect to have major forms of government assistance like PPP, employee retention credits, which certainly contributed cash flow at critical times to businesses. In your opinion, and we'll start with Renee, and then I want to get Kevin's perspective on this one as well. How has the federal government performed as it relates to businesses on Long Island, and what are the current challenges that you're facing?
So, thanks so much for that question.
You're welcome.
So from a federal perspective, it has been extremely helpful as we were recipients of the PPP loan and those types of opportunities. However, one of the things that I am finding is that although I do appreciate the way the federal government is responding to the needs of communities across America, such as behavioral health issues, it sometimes, as the government shifts, it sometimes impacts, things like youth services or other businesses who are not necessarily being seen at the forefront of these type of issues. So for example, Girls Inc., we're seeing a lot of behavioral health issues. We work with youth. We've had youth, pass out in the middle of program or have anxiety attacks. But when it comes to the greater issue of mental health, youth services or other types of nonprofits are not necessarily sought as the organizations that are in need of this type of support. So we kind of have to get it in an indirect manner. So that federal assistance may be passed down to organizations who will then potentially come to us and say, we need assistance, with the youth that we're serving, and then we'll kind of get it from a pass-through fund perspective. The greater help that we get on a regular basis from a government perspective is really us relying on our local government. So while the federal government, there's opportunity there, we're not necessarily seen as the first rung of people who might need support. So it's really important that we continue to advocate on a national level as well as a local level as far as what are the issues we as nonprofits are dealing with, who are our vulnerable audiences, and helping the government to see the impact through who we work with and the vulnerable populations that we deal with to say, there's need here as well, and here's how we can show you that, whether it's, issues of youth development, health issues, mental health issues, issues around, the specifics that our vulnerable populations are actually dealing with. So we have to continue to kind of just be out there and show them where the needs are, because when you look at a blanket, we're not always seen. Every nonprofit is not always seen. I can name a couple of nonprofits in this organization. When you think in the room, right, when you think of these issues and the impact, we're not getting that direct support.
Kevin, let me turn to you.
It's interesting. I guess we see it from the perspective, we bank a lot of not-for-profits. And so we see when we look at the financial statements, and listen, the federal government has done a tremendous job. I think the PPP and everything that got us to this sort of, closing in on the third year anniversary of COVID or the end of it. And so a lot of money's out there, but it's in very complex ways that it's very difficult for you to get to. So I think it's fair to say, yes, the federal government did its programs, and now they've passed it down to the states and to the local governments. And, we see it, quite honestly, as a bank, and there's, in some cases, large deposits held by local municipalities figuring a way to spend it. And they certainly don't make your job and the not-for-profit job easy to figure out how to get it. Unfortunately, too, it's a lot tied to programs that's not covering your administrative burden, which is also another challenge. So there is money out there. I think the complexity of how it gets in the hands of the people who need it is a challenge, and it creates sort of, I guess, an undue burden. Because I think a little part of what you said before, as companies deal with the things they're dealing with, related to inflation or just reduced profits, unfortunately, the places that they cut oftentimes is discretionary expenses, and some view as the sort of the community organizations as a discretionary because it's I gave you 10, I'll give you 5, and that hurts on the bottom line. But it does say something about the community that we are, and the room's full here, that is that as companies tend to stop giving, people start to give more, right? And so I think that in many ways, and not to get, I think, the fact that we all have survived COVID, right? And we've got through what was a very difficult and challenging time, in some ways makes us feel very thankful for what that is. And if organizations like yours and the other ones in this room that really sort of support the community that we're a big part of, if you can give back because you're thankful, I think that's a great thing that's happened.
So let's turn to the similar question, but state and local government views. So Rich, we'll start with you. What are they doing? What are state and local governments doing to assist? But more importantly, what should or can they be doing?
So to me, state and local government has really done a great job in supporting businesses and partnering everywhere they can to recognize that as the economy recovers, that's going to be good for everybody. And we're all dealing with inflation and the impacts of that. And as business leaders, we need to figure out how to best navigate. But the support is there, and the engagement is there. And I think one of the biggest, shot opportunities for us is that with all the funding that's coming from the federal government, making sure that it gets to where it needs to get to at the state and local level so that it could get to the people that need it. We recognize the fact that there's a focus on infrastructure investment, which is always a great way to continue to drive economic growth and opportunity, and we see that a lot. Just listening to the governor's state of the state, there's going to be continued investment. And I know if you, talk to your county and town officials, they all understand the need to partner with all elements of business. So I'm optimistic there, and I think they are doing a really good job of staying connected to the things that we need.
Great. Kevin, your thoughts?
I sort of echo what you're saying. I mean, we've been together enough. I think it's the idea that, we talked about young professionals, some of it is about housing, right? And so the efforts that are being made to basically take some of that federal money and just create the infrastructure that's necessary to continue for us to build the housing stock that sort of will keep our young people here. It's not just the jobs, it's some place to live. Unfortunately, we probably all have children, and we understand, not unfortunately we have children, let me back that one up. They're off the payroll, but off the payroll. But we all have children. Are they here? Are they not? And why did they leave? And sort of, are they afraid? Can they afford their house? Can they get a job? So I think the state and local governments have recognized that, and I think using those infrastructure dollars to help sort of give us the basic things and let the developers sort of go out and build what's necessary for people to live in.
Okay, so let's turn to the subject of capital improvements, technology investments, et cetera, because we asked our respondents several questions regarding this, and most plan on making some sort of investment in technology. And Rich, we'll start with you. What do you see as some of the major technological improvements companies can do here on Long Island?
We spoke a bit about remote work and how you best engage remote workforce. That's, I think, a critical piece as we're looking to become more efficient and effective in everything that we do, making sure that we leverage technology in a way that supports that, at least for us. Making sure that we are looking towards the future. It's sometimes difficult to be in the moment and face the challenges in the moment, and at the same time think about the investments you need to make for the future, because your bottom line is being stressed right now, especially with the impacts of things like inflation. For us, we understand the need to invest that way. I mentioned virtual reality before, and I think there's a great opportunity in several different business sectors to embrace that and make it not something that is a nice to have, but something that can really allow you to lead into the future. We have engaged some people internally, as I mentioned before, to develop our own apps to support our employees, whether it's our through human resources, having people be able to do everything they need to do without coming to the office. They can do it from their phone. So I think there's it's sometimes difficult to be able to just get your mind to the point where this is going to be a big investment and I don't know if I'm going to get the return for it, so it's a risk. But if you're not willing to take the risk, I think you're going to end up being left behind.
Great. Dr. Orr, let me turn to you as well from the healthcare perspective.
Sure. So Terry plugged me well on the Good Sam Mother Baby Unit, but that's just one of many, many investments, first and foremost in brick and mortar. We spoke a lot today about investing in our people. Can't do anything without an incredible workforce. But also our customers, our patients, and our secondary customers, who are our physicians and surgeons, they want state-of-the-art locations in which to work. So we'll be putting in over $500 million into Good Samaritan University Hospital. That is a major, major investment. By the time all is said and done in the next 5 to 7 years, we likely will have invested over $1.5 billion in capital, in brick and mortar. And it's not just all in hospitals, right? Very excited about mixed-use space and doing some work with Bob Coughlin and others and getting into what I call big box ambulatory. Because why? People want healthcare in their community where they need it. They want to be able to go in on demand, get an urgent visit, get a primary care visit, get a film, a scan, get their prescription, maybe get a cup of coffee, and go home. We're building a 60,000 square foot state-of-the-art facility in Centereach. It'll be the size of a big box ambulatory location that you may have shopped for hardware or other things, similar though in the healthcare space, on demand. Now that's brick and mortar, but technology-wise, you have to invest in the latest and greatest in clinical care, and we're making those investments as well. Robotics, minimally invasive orthopedic surgery, oncologic surgery, cardiovascular surgery. We do precision angiography at 2 of our locations. People come and train from all over the world to learn in these techniques, which is, I think, incredibly exciting. Minimally invasive neurosurgery without having to place a cut in your head, all done interventionally. So again, I think marrying the trifecta of the best people, state-of-the-art facilities, and the greatest and latest medical technology is what sets us apart, and those are the investments that we're making. We're committed to Long Island. We believe in Long Island, and we're going to grow here.
Great, thank you. So I have one last question for all of our panelists before I think we have some time for some Q&A. So questions from the audience after this question. We have a couple of microphones set up, so if you do have a question that you want to ask one of our panelists, time to think about it now and maybe step up to the mic. But before that, for all of you, what does the future of your industry look like to you?
So the future of our industry looks like this. We're all about equity. We hope to not be in existence in the future. We want to be able to make sure that all girls, that there's equity, that all girls are able to have the opportunities to be in whatever workforce that they want to be in. And from the perspective of nonprofits in general, I would love to see a world where we are not having to be so fiscally astute that the administrative side of our businesses, kind of because it's a business, has to suffer a little bit because of the programming side. So we have constant rising costs in everything, right? Inflation impacts our insurance cost, everything that we need to do business. But we're still required to minimize that side. So I kind of wish that for nonprofits, we are, as we have to run by a business, that more of the responsibility of managing and running a nonprofit is more respected. For Girls Inc. specifically, the future of Girls Inc. for us is with the rising issues we see in youth services that impact, everything, your future workforce, with the issues that we're seeing with behavioral health and cyberbullying and suicide and all the things that we see. My hope is that as we go forward, we will be able to continue to build an extremely viable organization to serve more of the youth across Long Island and eliminate in partnership with a lot of the folks that we work with, some of the issues that they're facing on a daily basis, and that we can do that in a way that allows us to not only thrive for the sake of the people that we serve, but be able to thrive as a community partner and as a business in the communities doing great work. So our goal is Capital Campaign. We're looking for a space where we can be able to be that home for girls and for the community itself, and just continue to be able to be a really a thriving organization that is able to sustain very well. We're doing good. We want to continue to do well and continue to serve our people.
Keep up the great work of your organization. It's wonderful. Rich?
Sure. So for our industry, we are heavily reliant on people. So I'm sure when I responded to the survey, human capital and HR was number 1, 2, 3, 4 for me. We are a STEM field and very broad in STEM. So architects, engineers, scientists, and we have all, accountants and marketing people and IT people and everybody that a business needs to round out. And we see a concern in the future, because if we're not able to continue to have the flow of talent and young professionals coming into our industry, we're going to suffer. We, as an organization, do the best we can to get into school districts and talk to kids in high school and have programs where you could introduce people that are 14, 15, 16 into what's it like to be an engineer, what's it like to be an architect, what's it like to be a scientist, because it's tough. It's challenging, and I think when you take a look at engineering as an example, there are lots of people that start out thinking they want to be engineers, and it's hard, and then they decide to do something else. Well, that's not sustainable for our industry, and we need to continue to invest in the best way we can. It's clearly my top concern over the next 5 years is, with all the needs and demands and things you talk about in terms of infrastructure and growth, if the AE industry isn't successful in continuing to breed, new engineers and architects, then, that's a potential issue for us.
Denial?
So, higher education industry, it's being disrupted. So we've got a major disruption going on right now, largely due to online learning. Don't expect that to change. Expect to see many graduate programs be fully online, partly online. Undergraduate, a little bit different. I think there's still some demand for that face-to-face interaction, and we know that schools are focusing on that to differentiate themselves from the online providers. But a lot of change in that space. Also, with the types of skills that employers are looking for, it used to be about degrees. Now we're seeing more and more competency-based hiring and skill-based hiring. So certificates are becoming more common. That sometimes complements a degree. So someone can get a skill-based certificate from a university, from elsewhere, that complements their degree, or perhaps we'll see more in lieu of a degree. So a certificate only. So we definitely have a lot of change ahead in higher education. So we've all got to fasten our seatbelts.
So we're in a consolidating industry. So there'll be less of us at some point in time. And we don't have the very cool technology that you have. I think that for us, it's continuing to use some level of technology to make our process more efficient, but still maintaining, as we get bigger as institutions, that we maintain that personal touch. I think I've been up here before and talk about, you guys all run businesses, people run businesses, and you manufacture things, you help people, you educate people. The part of that we do in providing the financing should be benign to your activities in accomplishing those things. And so we as an industry have to make sure that we're there. We have to make sure that, especially as we head into difficult times, that we're there to have the conversations and be partners with you. And it's for us too, it's getting young people in our industry. It's maintaining those relationships. It's attracting people to want to become bankers, to work in the finance field, in a field that is consolidating. So Do I have a career path? Because that is something. With people, we can have jobs, but where do you want to be in 5 and 10 years? And so that's the challenge that I think we have, and we have many other short-term challenges, but I think the long-term viability of sort of that personal banking relationship that I think has been the backbone and for these small and medium-sized businesses that really fill this room up, we have to make sure we can maintain that as we become bigger and are forced to become more institutional, but you've got to get the people on the ground that understand that there's still a people business.
Great comments. So healthcare, wow. It is a very, very challenging environment. If you follow the news, you'll see that virtually every venture capital company, every major company, whether it be Amazon, CVS, Aetna, Walgreens, they're all getting into the healthcare business. Perhaps they think they can do it better, and I wish them luck. Good luck. It's a growth business. Our vision is plain and simple, and that's to be the most trusted healthcare partner to all of you and to all the people of Long Island. As I mentioned, we are Long Island. This is our home. And building that trust, that high trust quotient, is so, so, so important. And again, a big piece, and I think going back to your comments, if we do our job really, really well, maybe 50 years from now, the healthcare system was going to look very, very different, right? I mentioned all the growth we're doing. We're not adding, though, new additional hospital beds. We're just actually making more private rooms. So I see more and more care shifting from inpatient care to ambulatory care. I see added pressures relative on rates and reimbursements. We talked a little bit about that. My colleagues up here talking about reimbursements both at the federal and state level. We have a multitude of challenges there. We have workforce challenges. But as I like to say, you know, the future of healthcare is here now on Long Island at Catholic Health. I think we have a very, very bright future. And I feel very privileged to play a part in helping to keep all of you and the people of Long Island healthy.
Thank you.
Thank you.
Well, thank you to our panel, of course, for all of your insights. We look for questions from the audience. If anybody has any questions and wants to step up to the mics. We have a little bit of time here for some Q&A. Oh, I see one.
As Mike knows, I can always find a question to ask.
Yes.
So this is probably Marianne for you. I know you mentioned that you're seeing that the students really want to come in hybrid, you know, they want that personal connection. I'm not sure I've seen that. I've seen a little bit more where it's a struggle to kind of get them to understand why it is important to have that face-to-face connection and come in and make those relationships, just because you're probably closest to the student's age. Is there anything you could suggest as to how we might be able to get that message across that, you know, this is for you, it's good for you to come in and make relationships?
Sure, great. Thank you for the question. Well, first of all, coaching and mentoring. If your new employees don't have a coach or a mentor, I would certainly recommend that as one way to help them build relationships that they feel trusting in, and then will hopefully heed the advice of someone with regard to a networking event. They don't have to go by themselves. You know, again, this is something that's unfamiliar to many of these new graduates. So providing an environment for them where they can ease into it. So someone accompanies them to an event, invites them to an event. That asking them to go out on their own, they might be a bit intimidated. Again, this is something they don't have practice with. So those would be some of the recommendations that I have. Also, just setting expectations, that this is something that is, you know, expected of them, to be in the office, to attend meetings, hosting luncheons. It sounds, you know, very common probably to many of us in the room, but it's something that they don't necessarily have familiarity with. So hosting lunch meetings and more informal settings for them to be more comfortable with that type of networking.
Good morning. I want to commend everybody and HIA for holding this event. I've attended many events over the last year from HIA on workforce development. I'm here to ask a question, but first I want to make a statement. The people who maintain all the equipment that all the businesses here use, Dr. O, you mentioned you invest in robotics. You have highly skilled surgeons who would be useless without the people who calibrate and maintain those robotics. Isn't that correct? And we need skilled trade workers. I'm glad to see that a major topic here was skilled trade workers and the shortage. My question is, do you think that the shortage of skilled trade workers is a more dangerous condition to the economy than inflation, which we all know will be gone in a year or two?
For the panel or for me specifically?
For anyone.
I'll start off. I do think it's a major issue. I think, to your comments, we are very, very appreciative of the great work of our trade workers and folks. And you look at not just on the robotics side, right, but coming out of ground, new construction, all the work that we're doing, electric, plumbing, it's very, very important. So I think it plays a key role. I think we have to encourage more to go into those fields to help support and build the overall infrastructure of what we're doing, not just in healthcare, but I'm sure my colleagues on the panel will add similar sentiments. So yes, I agree with your comment.
So I do as well, and I from my perspective, we all hear about the investments that are being made in infrastructure in general, but whether it's buildings or heavy construction, and that's great. But people need to design it, people need to build it, and if the capacity's not there to do the work, well, then the money sits. And you see that in a lot of places. So even though funding is allocated, there is funding that is sitting in the federal government, funding that is sitting at the state, because we don't have the wherewithal to go ahead and get projects moving. So from my point of view, I do also think it's a critical element of how we're going to move ourselves forward.
I too believe that it's a very critical element, and it's one of the reasons why Girls Inc. as an organization focuses very much on exposing girls as early as possible, like middle school, to opportunities in STEM and manufacturing. We've partnered with a number of folks in this room in order to expose them or take them to facilities to show them that those opportunities are available to them as well. It's a huge part of our curriculum. We've worked with H2M. We've had engineers from H2M come out and talk to the girls. So it is critical, and they are the future workforce. And if we don't introduce them to these opportunities early, when they get to 11th grade or 12th grade, it's kind of too late. So we want to make sure that they have this exposure, that they know that these opportunities are out and available to them, and that it's right here in their backyards on Long Island, that they can see a clear path from school or trade school into a viable opportunity for a great career, and they don't have to leave in order to do that.
Yeah, great point. There is a lot of economic opportunity for trade workers, and girls make excellent automotive mechanics. I teach automotive. I've had several cases of young women who are graduates of my program or trade schools. They make twice as much as the average college graduate. So for everybody here, if you have young people in the family, encourage them if they're interested in learning a trade. College is not the only path to success. And I'm not anti-college. I'm a proud Adelphi MBA.
No, and I appreciate
Also
a master certified mechanic.
No, it's certainly true. I mean, I think that has to start at the high school level, right? I mean, there has to be some discovery that at the high school level with the guidance counselor or even parents.
Middle school.
Middle school.
Where their children can have that opportunity. And it doesn't mean, but Suffolk Community College has many programs that are certificate-based that are toward that end. So I fully agree with you. I mean, at some point in time, we need the broad base of employees that can do that. And we have to figure out a way to make it so that it is a respected career, that it's not sort of the second choice. It's not an accidental way to get there, because it shouldn't be. There should be a direct way to get there from high school, understanding that and going in understanding that.
One last point. I have many examples of high school or community college tech graduates, technical skilled trade graduates. They immediately get a job making more money than their parents in many cases.
I have a proud union son as an operating engineer. He's college graduate, and he makes more than my other son, so I understand.
Hi. First, what an outstanding panel. Really insightful. One of the things I wanted to mention is, in terms of the economic recovery, there's been a lot of collateral damage as a region, and it's people that fuel our recovery, and I'm referring to the issue of mental health. So in terms of the workforce shortage issues that we're facing, mental health affects productivity, creativity, innovation, but it is something that is seldom really addressed outside of the human resources department in businesses. So I'm the new Chief Operating Officer of the Association for Mental Health and Wellness. I made a move from government and economic development work very precisely at this time, because I really would like to know from business, what are the things that you're facing with your employees and perhaps with the way that your workplace is organized that you see as barriers to your economic goals?
Okay, I'll start with that one. It's a great point. It's a hidden point. If you're not looking for it, you don't see it, but it clearly exists, and it goes well beyond our HR group, as you mentioned. And I think, first and foremost, making sure that there's engagement with your people, starting from direct supervisors all the way up. Making sure that there's plenty of opportunities to have safe conversations. In some cases, supervisors are not necessarily equipped to perhaps have those kind of conversations with people if they're really struggling with a mental health issue or concern. And there's no doubt that, I'm going to focus on our young professionals. Those of us that have been walking on the earth for a lot longer than young professionals, we have life experience that props us up when something like a pandemic happens. People that never experienced that before, the uncertainty that has been just forced into their lives in a lot of cases is just beyond their capacity to be able to cope with. And being empathetic and understanding that. And that's a little bit about, the fact that we have to be very accommodating to our people. A lot of it is driven by that. It's being sensitive and aware of the challenges that people are now facing, and from a business point of view, that's created a permanent shift. It's not going to be about driving people to perform. It's going to be about engaging, understanding what motivates them, and getting them to try to reach their full potential, supporting them. That's how you're going to improve efficiency and create more profitability for yourselves, not necessarily driving your people. So I completely agree with your point.
I would just add from a student perspective, we're hearing a lot more and doing a lot more with helping the future workforce be resilient, to develop resilience. And that's tough. As Rich said, these are individuals who have faced some of these challenges very early on. And so finding ways to bounce back from challenges, to reach out for support that they need, that it's okay to go and use the resources that are there. Adelphi, and I'm sure all other schools, have a lot of resources when it comes to the mental health of our students. And they need to know that it's okay. And so creating that safe space that you said, Rich, creating an environment where students can thrive and be resilient when they hit the hurdles that life is going to throw them.
I would agree with both of my colleagues. At Catholic Health, we've done all of that, all the above, plus really taking a look at what were some of the key stressors and drivers. And so it could be, like when I was an ED doc, you either worked 12s or you worked 8s, right? And so trying to create shift flexibility now for folks. Some folks want to do 2 4s. They want to split time. We do things like have a buddy system. So we have a coach and a mentor help people. We developed a Live Well program. We developed a telebehavioral health connectivity. And this is really cool. We put in all of our hospitals, we took an area and space and we created recharge rooms. And this is just an area where you could go in. I wish I had this when I worked in the emergency room. But you can go in, you can select the environment you want, and it's your time to just decompress, de-stress, and reconnect with yourself and kind of create some balance. So I think that's been very, very well received. All my hospital presidents, the numbers of folks that are going in there before a shift, after a shift, very, very important. And it comes down to culture. You have to have a culture of safety. You have to support each other, help each other. And the stigmatism around mental health issues is really one of the biggest obstacles we have to overcome as a society, because until folks feel that it is safe for them to come forward and say, I need help, that's where they're going to continue to feel that they have challenges.
Thank you. I was very deliberate and purposeful in my question because I really wanted to get a sense from such an insightful panel as to where you think your baselines are. And I want to encourage everyone in this room to start taking a look at your strategic plans with that lens, because when everyone is wondering what's happening with the Great Resignation and people who don't feel comfortable telling you that they're really struggling at work and they're calling in sick, or they're having an anxiety moment in the bathroom, this is part of what's happening. And sometimes even going to an interview is really challenging for people post-COVID. So May is Mental Health Awareness Month, and we are really looking to partner with all of you in any way that we can to support your businesses on any type of awareness or work on this. And just thank you for being so comprehensive in your remarks today.
Really, thank you. So certainly thank you for the great questions from the audience. We appreciate it. Glad we were able to leave some time for that at the end. I want to thank in closing for our great panel here, for your insights, your commentary. I think it was helpful for all of us in helping us to kind of analyze the results of the survey and really look towards the future in Long Island. So thank you to the panelists. And finally, just a reminder, the full report is available. You have your QR code, so scan it, take this home, just so you can review the full report on your own. Anthony, any?
I want to thank everyone for coming, and I do want to thank this panel. I want to thank Adelphi, and I want to thank Citrin Cooperman for putting this together. We heard a lot about skilled workers, and we heard a lot about putting investment on Long Island. So let's give them one more round of applause.